Hi, I'm here to support our transition to Bedside Shift Report. Bedside Shift Report promotes safety and creates trust between the patient, the family, and the nurse. It is universally accepted and considered best practice. I know any new process can cause fears and concerns, but we're here to support you through the process. Once your patient has given permission, you should have no concerns regarding HIPAA or incidental disclosure. I look forward to our improved patient satisfaction scores, reduction in falls and pressure ulcers, and improvement in our call light scores. I know you guys will do a great job and continue on our journey to excellent nursing care.
My name is Laurel Mansfield. I'm an oncology certified nurse who has attained my clinical level 4. In my 25 years at Pomona Valley Hospital Medical Center, I've experienced many changes in the reporting process. Today, more than ever before, it is imperative that nurses embrace patient-centered care. We hope to inspire you on national patient safety goals, patient safety, customer satisfaction, and team building. In my role as a nurse leader, I mentor and support my colleagues. Bedside reporting reassures the patient that the nursing staff works together as a team for continuity of care and patient safety. The patients witness a safe, professional transfer of responsibility and care. This encourages them to be active participants in their plan of care, resulting in a satisfying hospital experience.
Hello, my name is Leilani Reyes. I am a bedside nurse. I am here today because I truly believe in Bedside Shift Report. Why? Patient safety. In doing Bedside Shift Report, we are directly responding to Joint Commission National Patient Safety Goals, which are improving patient identification accuracy, enhancing better communication among caregivers handing off or managing off communication. We are encouraging patient active participation in their own care as a strategy to patient safety goal. And on top of all this, Bedside Shift Report is an excellent way in building teamwork, accountability, and ownership.
My name is Christine Corey. I'm certified as a medical surgical registered nurse on a neuropost-surgical unit that I proudly represent as a clinical level 4 nurse. As a charge nurse leader, we have chosen to promote Bedside Shift Report in collaboration with our charge nurse leadership team. We have found that Bedside Shift Report allows the oncoming nurse to see the patient right at the beginning of our shift. The SBAR tool allows us to give a thorough report specific to our patient's plan of care. During the next few minutes, we're going to show you some useful tools and strategies that will enhance patient safety, communication, teamwork, patient satisfaction, and patient-centered care. Together, we have developed communication tools that will ensure that all HIPAA guidelines are met, because we are talking about our patients, so yes, we can talk in front of our patients.
Come in.
Hello, Miss Marie, how are you?
I'm good, thank you.
My shift will be ending soon, and I noticed your sister is still here, but I wanted to make sure that it was okay that we discussed your care in front of her.
It should be fine. She knows everything.
Okay, good. Is there anything I can get you before the end of my shift?
No, nothing I can think of. The medication you gave me, it seems to be working.
That's great. I just want to make sure you had your call light in reach. And then if you didn't need to be positioned or anything like that, I will be back with the oncoming nurse that will take over for me for the rest of your day.
Okay.
Okay, are you okay? All right, then I will be back with her in a few minutes. Okay.
All right, thanks.
Thank you.
Come in.
Hello, Miss Marie.
Hello.
Thank you. This is Leilani. The nurse is going to be taking over for me for the rest of your day. And this is her sister Laurel, who stayed with her last night to help us out.
Good
Hello.
morning.
Good morning.
Miss Marie's the patient that I received from the recovery room last night with the chief complaint of abdominal pain. I have her diagnosis from surgery on the top of your SBAR report up there,
Okay.
as well as her history and previous surgeries up there also.
Okay.
Her sister stayed last night with us because she has a tendency to get disoriented after surgeries. So I put her on fall protocol and everything's in place. The sign, her armband right here, and her socks.
From previous surgeries, she did get disoriented, but this time she seemed to be okay. So I'll probably be leaving pretty soon.
That should be fine. We will continue the fall protocol as she mentioned, so to keep her safe. Okay?
Appreciate that.
You're welcome.
You know, she's dozes off and on, but she's been appropriate. She has no cardiac or lung issues. She's been on O2 until she's wide awake. Her IS, which is right here at bedside, she did about 750, but when she's more wide awake, she's going to need some reinforcement for that. Her IV's right here to her left forearm. It's intact.
Okay.
She's receiving LR at 125 cc's an hour. She had some clear liquid, but she got pretty nauseated, so I gave her Zofran 4 milligrams at 5:25 this morning. And I left her on clears, so you can advance that for breakfast if you'd like.
Okay.
Her pain was about an 8, so I gave her 4 milligrams of morphine, and it brought her pain down to a 4.
So how's your pain now, Miss Marie?
About a 2, but it's okay.
Okay.
She doesn't really tolerate pain medications well. In the past, the Lauded made her really, really sick to the stomach. But this time, the morphine seemed to be doing better. But anyway, I think you should list the Lauded as an allergy.
Well, we do have what we call side effect versus a true allergy. I could give you more information about it if you want.
I'll appreciate that.
Okay, you're welcome.
She has a midline incision right here if you want to look at it. Other than that, it's right here. Other than that, her skin's clean, dry, and intact. She has no Foley, but she also hasn't voided yet. Her bowel sounds are present, but she's not passing gas either at this time.
She does get incontinent at times, so maybe we can try a diaper?
You know, diapers are not really the best option just because of the high risk in getting bed sore. Well, anyway, is she on skin protocol?
Yes, she is. I got an order for that. Our pads are very absorbent, which replaced our diapers, and I also got her Calazyme cream, which keeps her skin very protected.
That sounds good.
That's good for her.
She got 2 doses of Zosyn already. Her 3rd dose today is due at 2 p.m. and her Lovenox is to start at 10 p.m.
10 p.m.
Yes. She's got sequential her sequential stockings to bilateral legs, and her orders to ambulate her 3 times today.
So that will be our goal for today, Miss Marie. We're going to control your pain and get you up and walking. Now, is there anything that's most important for you today that I can help you with?
Well, I'm very concerned about the biopsy. Do you have the results yet?
No, that's a very good question, but when the doctor comes in, I will have him come speak with you about that. Can you follow up with that, Leilani?
Sure. I'll let him know about your concern.
Okay, thank you.
You're welcome.
Her medications are all written down, and her med-rec is complete, so if you can start her
Okay.
with that today. That ends my report unless you have any other questions for me.
No, thank you for everything you've done.
You're welcome.
I think you covered everything, but I will just get a report for another patient. So let me put my name and number on the board. So you can call me with that number on your phone, or you can always use the call line. Okay?
Thank you.
Thank you both very much, and you guys have a great day.
Thank you so much.
Okay. And I'll get back to you.
By the way, her biopsy results are back, and it is positive for cancer. So if you could have the doctor talk to her about that, that would be great.
Okay, I'll call the doctor. The patient looks very concerned.
Yes, she is very concerned. So if you could follow up, that would be wonderful.
Okay,
Okay, you have a great day, and I will see you tonight.
thank you.
Thank
Have
you.
a good one.
You too.
Bye.
Bye.